If you find it challenging or impossible to move a specific body part following an injury, it may suggest a broken bone. You're out there on the soccer field, playing football or baseball. You got into a car accident, fell off your bike. These are a very common injury and can affect anyone at any age. If you're older than 50 or have a family history of osteoporosis, signs and symptoms of a broken bone include swelling or bruising over a bone, deformity of an arm or leg, pain in the injured area that gets worse when the area is moved or pressure is applied, an inability to bear weight on the affected foot, ankle, or leg, loss of function in the injured area. In open fractures, bone protruding from the skin, fractures are usually caused by a fall, blow, or other traumatic event. Attempting to move the affected area may cause sharp pain, making any further movement uncomfortable or impractical. It is crucial to immobilize the injured area and seek medical attention promptly. When faced with a broken bone, it's crucial to make an informed decision about seeking medical attention. While some fractures may be manageable with rest, ice, and elevation, others require immediate evaluation and treatment in the emergency room. The emergency center is open 24 hours a day, 7 days a week to evaluate your injury and provide prompt diagnosis. Our emergency facility is equipped with high-resolution diagnostic imaging, including a 64-slice CT scanner and digital X-ray, to allow us to quickly identify the problem and provide appropriate treatment. When it's time to leave, we can also give you a med pack with up to 72 hours worth of any necessary medications, allowing you to head straight home to rest instead of stopping at a pharmacy. Here we go. 1. It hurts. First and foremost, if you have a broken bone, it almost always hurts. Like 99% of the time. Total agreement there. One of the primary indications of a broken bone is intense pain in the affected area. If you've experienced a traumatic event and are feeling severe and persistent pain, it may be an indication of a fracture. Additionally, swelling, bruising, and tenderness around the injured site are common signs of a broken bone. If healing is progressing as it should, the bone should eventually be able to bear weight. If the bone involved isn't a weight-bearing bone, be on the lookout for extremely limited movement that does not improve despite physical therapy and following your doctor's instructions. 2. Pain and swelling. Next up, look down at your arm, leg, ankle, or wherever the injury is. Is it swollen? And possibly even red? Swelling, especially when combined with pain, is a big red flag for a potential broken bone. If it's red, hot, and swollen, it very well could be broken. A continued, aching pain, often felt deep within the bone, is one of the most obvious signs a broken bone is not healing. While it is natural to expect pain in the broken bone, this pain should gradually get better. This is why we always want to know your pain or discomfort level throughout the treatment process. Pain that gets worse or fails to subside should be addressed by one of our orthopedic surgeons in Raleigh. 3. Deformity. Another apparent clue of a broken bone is a visible deformity or misalignment. If you notice that a limb or joint looks visibly crooked, out of place, or misshapen compared to the unaffected side, it's likely that a fracture has occurred. However, it's essential to note that not all fractures result in a noticeable deformity. This one's often pretty obvious. It looks weird. It doesn't look like the other side. You try to stick your arm out straight and it goes off at an odd angle. If it's crooked or deformed, that's a strong indicator. 4th, loss of function. Can you do what you normally could? If you can't lift something, can't stand on your leg without falling over, or the pain is so intense you simply cannot bear weight on it, that's a loss of function. Your body is telling you something is seriously wrong. A broken bone often hampers your ability to move the affected area or bear weight on it. If you find it challenging to move a limb, experience difficulty in performing daily activities, or have a sudden loss of strength or function, there may be a fracture. This limitation in mobility is especially significant if it persists for an extended period. 5. History of trauma. Did you hurt yourself in some way? There was some form of trauma. You fell off a ladder and now your foot hurts. That foot might be broken. There's a clear traumatic event. Sometimes, a broken bone can cause abnormal sensations near the injury site. Numbness, tingling, or a pins and needles sensation can indicate nerve damage resulting from the fracture. If you experience any unusual or persistent sensations, it is important to consult a medical professional for an accurate diagnosis. Remember, when in doubt, it's always better to err on the side of caution and seek emergency medical assistance. Do you always have to have trauma for a bone to break, though? Not always. In rare cases, other underlying issues can lead to what we call pathological fractures. These are fractures that occur with very mild trauma, or even no trauma at all. Conditions like severe osteoporosis, certain cancers, or metabolic bone diseases can weaken the bone to the point where it breaks under normal loads. Thankfully, these are rare, but just because you didn't have a major trauma doesn't automatically mean it's not broken if you have the other signs. You can also have a stress fracture, which is a type of fracture from overuse. We often see this in soldiers who march long distances, or in runners. It's not one big trauma, but rather repeated microtrauma over time. So, how do we definitively know if a bone is broken? Is it with a laser? What? No, not a laser. We use an X-ray. X-rays are usually the go-to. But are X-rays always conclusive? You might be thinking, I'm still really worried this bone is broken. What else could we do? Check out our video on growth plate injuries, as those sometimes don't show up on X-ray. Other imaging options for more subtle fractures include a CT scan or an MRI. For stress fractures, even a very subtle one, a bone scan might be used. We have various imaging modalities available to us to confirm these fractures. But you're not going to wheel a CT scanner out to the soccer field. You want to be that know-it-all parent who can confidently say, "Yep, that's broken," because you've seen the 5 signs of a fracture. Thankfully, with the help of modern medicine, most broken bones do heal within time. Granted, the length of time varies depending upon the extent of the break, which bone was broken, and whether or not surgery was needed. Most simple fractures will heal within 6 to 8 weeks. However, more severe breaks to bones like your femur, thigh bone, can take several months to heal. With all these variables, how can you be sure your broken bone is healing? There are a few techniques for bone stimulation. One uses a low-intensity ultrasound pulse, while another uses a very low-level electrical current. The low electrical stimulation model works by tricking your body into believing that you have been recently injured. As a result, it sends proteins to the site to begin the repair process. By contrast, an ultrasonic bone stimulator helps improve calcium in the bone in addition to sending healing proteins. So, there you have it. A quick guide to help you figure out whether or not that bone might be broken. If you like this video, please give it a thumbs up and subscribe to our channel. And remember, you are in charge of your own health. We'll see you next time.